Hi, my name is Christina Matherly, and this is my population level health education intervention presentation. The four main health issues is obesity, poor nutrition, lack of exercise, and lack of education. And these are the health-related problems that I found in the city of San Fernando. In San Fernando, one of the main issues was obesity due to the lack of healthy options available. There was also very few places in the community to exercise and a lack of education on proper nutrition and how to prevent obesity, which can lead to chronic health issues. The health education topics we'll focus on are ways to eat healthier and exercise. Some background information about the population in the city. Is obesity and a lack of knowledge. Adults living with obesity are more likely to have chronic health issues. The Hispanic adults living in poverty are at risk for obesity and associated chronic illness. The San Fernando population is 91.6% Hispanic, with 18.6% living in poverty and a lack of access to healthy food choices. The rate of obesity will continue to grow if interventions are not attempted. Also, with this population, there's so many chronic health issues that are related to obesity, which you can see is heart disease, diabetes, hypertension, and many more. Poor nutrition. The poor nutrition is one of the contributing factors to obesity. With 18.6% of the population living in poverty, they lack access to full service grocery stores. So, eating at fast food restaurants is more convenient for this population. And due to the lack of grocery stores, these families are also more likely to choose the fast food than going to the grocery store. There is a lack of exercise within this population. The total population for San Fernando includes 24,717, with Hispanic or Latino making up 91.6% of the population. Due to crowding, there's also a lack of recreational facilities to exercise. There simply is just not enough room to build parks or have gyms in the area. So the Healthy People 2020 objectives for obesity and education, what I found was according to Healthy People, Hispanics had an obesity rate of 44.9% for adults. Most recent, in 2013 through 2016, the rate of obesity was 38.6 among adults and aged 20 years and over. For nutrition and exercise, there was an increase in the proportion of physical activity guidelines for aerobic physical activity and muscle strengthening activity. Also, last 2020 objective is to reduce the consumption of calories from solid fats. So the need assessment. The first thing I noticed for the need, what is needed of this community, was through the windshield survey. I saw that there were no parks to exercise in. There was a lack of grocery stores due to crowding, and fast food options were available on every single street corner. This is how I determined personally what the need of this community. I spoke with a key stakeholder, which her name was Audrey B. She's the community college health nurse at College of the Canyons, and she stated that people within the community are not aware of how to cook healthy or where to even purchase groceries. Also, local residents, the residents within the community stated that eating healthier choices is more expensive. So with fast food, they can buy family-sized meals that are cheap and easy to feed the whole family. It's just more convenient for them to choose the unhealthy options. The health risks. The link between obesity and many of the leading causes of morbidity in the U.S. include cardiovascular disease, diabetes, and cerebrovascular disease. So this is a huge need for this community because all the poor health choices that they're making will eventually lead down this road to poor health outcomes. So the theoretical framework model, I used the precede proceed model. In phases 1 through 4, it included defining the ultimate outcome, identifying the issue, examining the factors that influence behavior, lifestyle, and responses to environment, and phase 4, identifying the best practices. Within this phases of 1 through 4, I collected demographic data. I obtained information through survey and interviews to determine the issues that were important to the community. In phases 5 through 8, it included implementation, process evaluation, impact evaluation, and outcome evaluation. In these phases, I prepared teaching visuals. I developed a teaching care plan. I also presented the education to the audience, which was at a community college. I next evaluated the impact of the teaching project and developed long-term goals from the expected outcomes of the teaching project. So some of the issues and barriers specifically that I encountered upon this educational instruction to the community, I found that some of the students said they had a lack of support from family to eat healthy. So sometimes some of these families, they live very close together and they all, it's not unlikely that you'll still have some of the kids still living with the parents, and they're used to their mom still cooking them food. So they eat whatever they've been used to eating. They also have a limited access to healthier food options. There's not a whole lot of grocery stores in the area that can provide the healthy options. And there's a limited resources and recreational areas to participate in physical activity. So it was difficult to find ways for them to exercise when there isn't any parks or any gyms available. Some of the assets that I found, there was a willingness to learn. There were uh, there were students that wanted to know how to improve their health. Um, Also, there's educational resources available to meet specific cultural needs. I had educational materials to hand out, which was really helpful, and I had the school education services such as the Health and Wellness Center. So the intervention that I did for obesity education was getting them to understand healthier food options. I also referred to places where they can receive education and public health clinics to obtain even more knowledge if they can't always make it to to educational monthly gatherings. For nutrition exercise, I handed out a pamphlet that had instructions on how to make a grocery list and plan ahead for the week. So within that pamphlet, I put instructions on how to stay organized with grocery lists so they don't avoid buy items that they don't need. So it's important to walk into a grocery store with a list already planned out, and also plan for the week. Don't forget to include foods like fruits and vegetables, and also make sure you have enough for the week so when you get busy, they don't fall behind and end up giving into fast food options. I also taught them on the pamphlet that size matters. I taught them to be careful not to overdo it when it comes to how much they eat before they exercise. Some people think because they're exercising that they could eat more, and really it just helps. It doesn't help because they end up feeling tired and sluggish eating a big meal before or after. So it's better to include small meals and snacks throughout the day. And ways to increase physical activity at home, because I found that one of the big barriers was that there was not enough places to exercise within the community. I instructed them on ways that they could get more physically involved without having a gym or a park. And that would include like getting the whole family involved and enjoying an afternoon bike ride. If there's a local school around, they could use a soccer field or softball field to walk up and down. They could get exercises cleaning the house, washing cars, choosing to drive less and drive a bicycle instead or walk. They could even do stretches while watching television. They could use an exercise workout video. They could take a nature walk, but most importantly, it was for them to have fun while staying active. So they would continue to be able to exercise and enjoy doing it. So for the Healthy People 2020, um, intervention was reduce the consumption of calories from solid fats, which also we went over on choosing healthier options such as vegetables. That's a perfect way to avoid fats. There's no real guesswork in that. All vegetables, are low in fat, and also increased proportion of physical activity guidelines for aerobic physical activity and muscle strengthening activity, which they can do by doing stretches and exercises at home while watching TV. So for the budget and logistics, the cost, after going over everything, the cost of there's a cost for making printouts of handouts and pamphlets, obtaining a place to hold educational sessions. Uh, the school was free, so it didn't cost anything. So it's best in the future to choose schools or even churches or places like that. The nurses and registered dietitians that can volunteer, so you don't have to get a come up with payment there, and cost of healthy snacks to provide during educational sessions. This helped bring in the crowd of people, and I estimated roughly about $250 a month. Logistics, registered nurses and registered dietitians who can educate the community on a monthly basis. So if we could get regular volunteers, that'd be great, and we could continue educating. Also, a location to hold the classes, which can include a school, church, or a library. Could also rent out a conference room locally, which would probably cost money, so it's best to choose. I found using the school was perfect. Okay, the project evaluation outcome measurement. How I measured the goals and objectives. By the end of the educational presentation, the student will be able to identify healthy foods and where to exercise and shop for groceries. And then by the end of the education presentation, the student will be able to identify the health risk factors associated with obesity. Those were my main goals for the students. And I measured it through just counting how many places that they could list on places to exercise or ideas that they could do at home. Um, the For the evaluation, for short-term success, would be include being able to verbalize healthy foods and places to exercise and shop for groceries. So using a teach back method, being able to just tell me like what they've learned and being able to identify those places. For long-term success would be measured through students following educational instructions and returning back to the educational classes. Providing a survey can also be useful in finding out if the education material was useful, so I could improve on it later. If they want more information or they find it's not helpful, I could use the surveys to make these long-term goals more successful. So results and conclusions. The main health issues in the city of San Fernando is obesity due to a lack of proper nutrition and lack of exercise. The main teaching points included how to shop for healthy groceries, teaching them that size matters, and ways that they could find to exercise even when they think there's nowhere to exercise. There's plenty of ways to exercise. Some of the weaknesses that I found with this doing this education presentation was the willingness of the students to learn to actually make changes. Some seemed interested like they would make the changes, and some just seemed like they came because they wanted free food. So I guess we'll have to see in long term how well it worked with more educational activities and see if people are actually following these guidelines with like a survey or something. And then also finding a place to educate students. I had the health and wellness center, but it was a very small area, and we had to put on the educational presentation during lunchtime when the office was closed down. So there was very limited space. I had to move things around and pretty much do it during the lunch break because it's a full functioning health clinic where there is patients that are students that are seen there. So it was a very short window to get that done. Some of the strengths I found was using teach back methods such as questionnaires to see if the students are retaining and learning any information, and providing snacks during education is good examples. And it also brought people into to the educational class that I was teaching. And here is my references.